Okay, so today we are covering chapter 6, which is our new chapter. It's a really short chapter and a really easy chapter. And your actual SAC for this chapter is going to be like another project. So, oh, sorry, not another project. It's going to be a project, okay? So it's going to be a research project. You're going to be basically researching a youth health issue. So a lot of you have the opportunity in this outcome, in this SAC that we're going to be doing, to do really well, because again, research projects, you're going to be doing it from home. You're going to have like a bit of time there to complete it, and you can really do an excellent project there and get an excellent mark. So try to make sure that you do your best for this outcome, because this outcome SAC again is one that all of you can kind of do well in. Okay, so we will talk more about that later this week, but for now we'll just finish off the content. So anyway, chapter 6 is all about talking about the focus on health and well-being. So when we talk about youth, what kind of things are we focused on? What are the issues or the concerns that we think about when we think about young people in Australia? So we've already covered quite a few of them in the previous chapters. We've looked at alcohol use, we've looked at smoking, we've looked at drug use, we've looked at injury. All of those are kinds of issues. So now we're kind of moving on to the kind of mental health side of things. So we're looking at what are the kind of mental health and well-being impacts that we see in young people. And we're going to be mainly using the examples of anxiety and depression. Okay, so basically when we're talking about mental health and well-being, and you might have seen this in health, or if you're doing psychology, you might have seen this in psychology. This is basically what we call as a mental health continuum. Okay, so basically on one side you've got mental health, and on the other side you've got mental disorder, and in the middle you've got mental health problems. Now the majority of us will generally shift between mental health, and sometimes we might experience mental health issues like stress or anxiety. They fall under mental health problem. People who have things like depression or bipolar or personality disorder or, those kinds of mental disorders, they basically are suffering from major impairments to their mental health and mental functioning. So they are those are what we call as a mental disorder. Okay, so just understand that at any time, young people can be on any part of this continuum. You might have one young person who's mentally healthy, and then you might have another young person who is suffering from a mental disorder. So it really depends on a number of different factors, some of which we'll look at today. So before we look at some of the different factors that might influence mental health in young people, we need to look at some definitions here. So the first definition is already one that you've learned from chapter 1. It's the general definition for the mental dimension of health, talking about the fact that mental health is a state of well-being in which an individual realizes their abilities, they can cope really well with stress, they can work productively, and they can make a contribution to their community. So those are the main things that you've got to include in a definition of mental health. Then we've got mental health problems. So like I said before, mental health problem is mainly to do with things like stress and anxiety. And these are things that are not actually majorly affecting your daily life or your daily functioning. So we're talking about a person might be experiencing stress or anxiety. It's a period in that person's life. It's not their entire life. They're not suffering their entire life with that stress or anxiety, but it might be a certain period. Like, for example, a lot of VCE students start to experience stress in the month before the final exam. Or a lot of the time when you're searching for a job and you're going to interview after interview, that period of your life, you're experiencing that stress and anxiety. But after you get a job, you're all good. You're back to normal mental health. Okay, so mental health problem, it does affect the way a person thinks, feels, and behaves, but it's usually of a shorter duration and it's not as impacting as an actual full-blown mental disorder. And obviously when we move from mental disorder, we know that a mental disorder is a state and it involves thoughts, feelings, and behaviors that are usually distressing to the individual that are experiencing them, cause some kind of impairment, lead to atypical thoughts, feelings, and behaviors. Atypical means not typical or not normal. And it leads to some kind of dysfunction, which means that the person can't function normally. So we use this memory tip iPad to remember that mental disorders are about I for impairment, P for personal distress, A for atypical thoughts, feelings, and behaviors, and D for dysfunction. So just remember it like that. And remember, mental disorders always are able to be diagnosed. So you can put a name to it. You can say, okay, this person is experiencing depression. That person is experiencing specific phobia. This person is experiencing bipolar. She's experiencing schizophrenia. So you can put a name to it as well. Okay, so those are our main definitions for mental health problem, and mental disorder. These definitions are really important for this chapter, and they're also obviously important for if you're deciding to do psychology next year. These 3 points make up an entire topic in Unit 4. Okay, so it's important for us to be familiar with them. So now that we finished looking at what mental health problem, and mental disorder are, we have to understand what is anxiety. So obviously, a lot of us, using our general knowledge, we know what anxiety is, but then we can't put it into like an actual like textbook definition. So this is kind of like our textbook definition for anxiety, okay? Whether you look at it from a psychological or from a health point of view, anxiety is defined as a state of physiological arousal, which means that it leads to biological processes like increased heart rate or increased perspiration or increased breathing rate. So it's a state of physiological arousal because usually anxiety is connected to our fight-flight response as well. Okay, and anxiety is this sense of unease, this sense of worry, this sense of uncertainty that something's wrong or that something bad or unpleasant is going to happen. Okay, so generally people with anxiety, there might not be an actual threat in their environment. Okay, there might not be an actual thing that they need to be worried about, but they're just simply worried or uncertain that something bad is going to happen, even when nothing in their environment suggests that that will be the case. And people who have anxieties, people who have anxiety to such an intense level or to such an extreme might go on to develop an actual mental disorder that's related to anxiety. And we call them anxiety-based mental disorders. And these are disorders like panic disorders, and these are disorders like phobias, these are disorders like social anxiety. All of these can actually be classed as mental disorders. Okay, so that's basically what anxiety is about. And again, there's a lot of stigma around anxiety as well. And we've learned about stigma with reference to, was it in psychology or health? Stigma is basically like negative labeling. Okay, so it's when you see someone with a mental disorder and you kind of tell them to cheer up, but you wouldn't really tell someone with a broken leg to cheer up, you know? So you give physical disorders more importance than mental disorders. So a lot of people with anxiety might, for example, might be kind of pushed around, and people might be like, you know, get some guts. It's all in your head. Why can't you just cheer up? Why are you always worried about everything? Why are you making a big deal out of everything? Stop being dramatic, blah, blah, blah. So there's a lot of negativity or negative kind of atmosphere or kind of a negative stigma there that we have for people who have anxiety. People don't take them seriously. So how does anxiety in young people affect their dimensions of health and well-being, or basically their 5 dimensions? So number 1, when you're anxious, you're likely to have an increased heart rate. You're likely to not be able to sleep properly at night. You're likely to have panic attacks. You're likely to feel like there's a tight feeling in your chest where you can't breathe. And you're likely, because of all the stress that you're experiencing with that anxiety, you're likely to have a lot of issues with your bodily functions. So things like digestion, you know, all that kind of stuff. Mental health and well-being, obviously anxiety itself is a mental health impact. So in addition to anxiety that a person experiences, a person can also experience feelings of stress, and their thinking or their thought patterns can be kind of like warped as well, or kind of interrupted there. Emotional health and well-being, so we've got to link it to feelings. So people who are anxious generally feel sad. They feel frustrated that they're always worried about stupid things, and they feel angry at themselves and maybe at others as well. Social health and well-being, so anxiety can stop people from properly talking to their friends, from properly talking to their family, from going out to school, from maybe applying for a job or going to work. And spiritual health and well-being, so people with anxiety can have a reduced sense of hope for the future, and they tend to kind of think in negative ways that make them not really like make, you know, long-term goals, or, you know, make long-term plans. And they might not feel like they belong to a community group. Okay? And this can be influenced by social health and well-being, because if you're anxious, you're less likely to go out and join a club or join a community group. And so the spiritual health and well-being can kind of get affected as a result of that as well. Okay, so that's basically the impact of anxiety on the 5 dimensions of health. It's really common sense as long as you know how to link it to these dimensions. Depression now. Depression is an actual mental disorder, which all of us would be familiar with. So depression is basically a mental disorder. It's a mood-based one. So we've got anxiety-based mental disorders, and then we've got mood-based mental disorders. Now, depression is an example of a mood-based mental disorder, as is bipolar disorder, okay? So depression is a mental disorder which causes low mood, and that low mood doesn't go away. It's not like you wake up and you're in a bad mood that day. It's like something that you're always experiencing. Depression makes people feel very sad, feel withdrawn, don't want to talk to people. If you ever Google like depression on Google Images, you'll find like pictures of people kind of sitting in like a abandoned alleyway or like abandoned laneway just by themselves, because that's kind of what depression is about. Depression isn't the fact that no one wants to talk to that person, it's the fact that that person withdraws themselves from other people. Also, when we talk about depression, we have to remember that depression is a mental disorder which leads to impairment. Remember the I in the iPad memory tip? So I for impairment, okay? Impairment means it really kind of stuffs up or interferes with the way we function in daily life. Now, people who have depression actually also have high levels of anxiety. So the two kind of go hand in hand. And when we look at it from a gender or sex point of view, young females are more likely to have depression than young males. And we have looked at data about this, and we've looked at the reasons for why this might be the case. So if you remember, we talked about the fact that females tend to kind of be more likely to go to a psychologist where they can get diagnosed with it, and that data then gets counted, whereas males tend to hide their depression a little bit more, so they never bother to go to the doctor or go to the psychologist about it. So those statistics can be unaccounted for. Okay, now we're looking at basically depression and anxiety as a whole. So obviously, like we said, people who have depression generally have anxiety. So these are the kind of impacts on health and well-being when we look at depression. So number one, people who have depression often experience issues with their physical health and well-being. So basically what can happen is that you can have, again, issues with sleep, issues with digestion. You can feel really low energy or fatigue, always exhausted all the time. Some people actually, it really depends, to be honest. Some people who have depression tend to overeat. So they eat their feelings, they comfort eat. Some people tend to lose their appetite completely and not eat at all. So it depends. So your body weight can fluctuate according to that. That's also a physical health and well-being impact. And we look at mental health and well-being. So obviously feeling stressed and anxious, that's pretty obvious. They tend to think negatively, so they're very pessimistic. They tend to have low self-esteem, and people with depression also have low self-confidence. Emotional health and well-being. So obviously if you've got depression and anxiety, you're going to feel sad. You're going to feel frustrated at your situation, and you're not going to feel a sense of self-satisfaction or self-fulfillment there. When we look at social health and well-being, we're basically talking about social isolation. So the person, again, withdraws or disconnects from other people and from events around them. And spiritual health and well-being is basically like a reduced motivation. So they don't have a sense of hope for the future. So again, all the impacts that we're talking about for depression are almost identical to the impacts on anxiety as well, okay, that we looked at on the previous slide. So if you know at least maybe two dot points from each of these little colored boxes here, that will be more than enough for you for the SAC. Sorry, not for the SAC, for the exam, because we won't have an actual traditional test or SAC for this one. All right. This is just a little infographic here to just show you guys like what depression kind of looks like in Australia. So by the age of 18, regardless of your gender, in general, 1 in 5 people will have experienced depression. So as a young person, at least 1 in 5 people will have experienced depression. Now, what are some warning signs that you can tell to see that someone could be suffering from depression? Well, number one, they're really moody all the time. They could be really irritable. It's not just a day thing. It's not just a week thing. It's like every time you see them, they're like that. A loss of interest in kind of life, a loss of interest in activities that they were once interested in, withdrawing from friends and family, so kind of excluding themselves from daily activities. And then when we talk about what's it called, appetite. So as we said before, a person might overeat more than usual, they might undereat more than usual. Irregular sleeping patterns, so the person might not go to sleep on time, they might wake up really late. A lack of energy and motivation is another one, and difficulty concentrating, okay? So if not treated, depression can lead to a lot of issues. It can lead to, like you see in this picture here, academic impacts at school. So the student who might have been doing really well in school prior to this, they will start doing really badly. You can talk about poor physical health because the person might not have the motivation to exercise or to eat healthy. You can talk about alcohol and drug misuse. So a lot of people use alcohol and drugs as an escape from the harsh realities of their lives. So a lot of the time, people can, use drugs as an escape, okay? And that can then lead to alcohol and drug misuse. So when we're talking about 6.3 now, 6.3 is pretty much connected to 6.2. It's just like part 2. So the previous, what we've done just previously now is part 1. So this is just the connecting kind of spread. So 6.3 kind of focuses now on, like I said before, the factors. So we're looking at the risk factors and the protective factors. Okay, so what is a risk factor and what is a protective factor? We've gone through these before. Basically, risk factors are any factor that increase the risk or increase the susceptibility or vulnerability of a person developing a health condition or disease. So most risk factors are negative. They're not good for us, and they will generally increase the chances of us getting a particular disease. So just think of it this way: risk factors generally put your health and well-being in danger. Okay, they're not good for you, they're risky to deal with. Protective factors, on the other hand, are any factor that reduce or alleviate the risk of developing a health condition or disease. Because of this, protective factors actually protect you, they shield your health and well-being and help you to maintain excellent health and well-being. So just for the purpose of an example, a risk factor could be something like smoking. There's no situation you can think of where smoking could possibly protect your health, okay? It's always going to put your health and well-being in danger. Same thing with alcohol consumption, same thing with illicit drug use. All of those things are things that will put your health in danger, regardless of what situation you think of. A protective factor could be something like having a nutritious diet or exercising frequently. There's no reason as to why having a nutritious diet or exercising frequently could affect your health and well-being in a bad way. It will always protect your health in a good way. Okay, so when you think of risk factors, they're always bad things. In other words, protective factors are good things, okay? And these can influence whether we develop a health condition or disease. Now, when we look at the prevalence of mental disorders in Australian youth, there's a lot of statistics in your book, a lot of graphs. I've just chosen one of the graphs from your book for this slide here, one that's easy for us to look at and understand. And it kind of reinforces or supports that thing we just talked about before, that the fact that females have a higher level of mental health issues generally than males, or at least they're more diagnosed than males in Australia. So if we look at here, this data is taken from Mission Australia. Mission Australia is a kind of youth health organization. They've basically completed a report in 2016, and this is basically showing us the level of psychological distress. And remember, psychological distress is basically negative stress. So it's looking at the kind of amounts of negative stress that people aged 16 to 17 years old experienced in 2016. So if we look at this here, prevalence, we're looking at the percentage here, and the green bar is females, the blue one is males. So 11 to 15 years old, we've got 7.2% of females experiencing negative stress. And you can see how quickly that number jumps from the ages of 16 to 17. Okay, we could think of like a lot of reasons for why this might be the case. So obviously when you enter high school, or when you're entering your last few years of high school, 16 to 17, that's when most kids will be doing their VCE or their end of year schooling. So basically that is probably one reason for the high levels of stress. Another reason could be thinking about what you want to do after you finish school. A lot of the time that can also lead to stress. And basically when we're talking about, things like even with males, for example, we see a quick increase there. Okay, so you can attribute a number of reasons to why the high levels of stress are actually more apparent in 16 to 17 years old as compared to 11 to 15. Generally, you have less things on your plate when you're 11 to 15 years old. That's kind of up to year 10, I suppose. And when you enter year 11 and 12, it's a little bit more intense in terms of stresses and things like that. Okay, so that's basically just a little graph to show you what the prevalence looks like in terms of mental disorders and mental health issues. Okay, this is a table now that shows us the risk and protective factors. So when we're looking at risk factors and protective factors for anxiety and depression, before you start having a panic attack and being like, oh my God, why is there so much to memorize? You don't have to learn everything. I would say just learn at least 1 or 2 risk factors and 1 or 2 protective factors. Now, you don't need to be able to categorize them. So I'm not going to ever give you a question, or you're not ever going to be asked in a SAC, identify 1 risk factor connected to family for the topic of anxiety and depression. We're not going to ask you that. We might just generally ask you, okay, identify 1 risk factor or any risk factor for anxiety and depression. So just learn any 1 risk factor or any 2 risk factors and any 2 protective factors. Honestly, a lot of this is like common sense. Okay, so obviously if you live in a family that has domestic violence, that's going to be an increased risk for you to develop depression or anxiety. If you look at, for example, a family history of mental disorders, that's obviously going to give you an increased risk. Same thing with protective factors. So if you've got good coping and problem solving skills, obviously you are going to be protected against anxiety and depression. If you've got, for example, supportive relationships, obviously that's going to help you against anxiety and depression. So at least memorize 1 for the SAC, but even if you forget about this slide, honestly, you could just make it up and chances are that it will be correct anyway. Okay, a lot of this is common sense and a lot of you have enough health literacy to understand or to have this in your general knowledge. Okay, cool. So now we're moving on to 6.4, which is part 3 of our topic that we're doing today. So again, I don't know why they've divided into 3 parts when it could just be 1 spread, but that's what your book has decided to do. So anyway, 6.4 part 3 is just continuing talking about anxiety and depression. And now we're basically looking at kind of connecting it to programs. So when we develop a program related to mental health, so when we, for example, create a program aimed at reducing depression in a particular state, or reducing anxiety or in a particular state, or reducing mental health issues in young people, what are the kind of values and expectations that the community expects from that program, okay, for that program to work? And so we use the memory tip CARES, so CARES, to remember what are the different values and expectations that the community has from a program. So these are basically what the program or what the health program should be reflecting. Number 1, the community expects that the health program reflects the value of confidentiality. Okay, confidentiality means that whatever happens in the program kind of stays in the program. Okay, if a person comes into the program, tells you all about their stresses, you don't just go and vent it out on Facebook or tell your friends about it at, when you go out for dinner with them or something. That's not confidentiality. Accessibility, so everyone should be able to access the program, not just 1 or 2 people, not just a certain group of people. You can't discriminate who can be in the program and who can't. Respect, so when a person joins that program, you should treat them and give them that respect as a human being. You should understand their situation and have empathy for them rather than belittle them, or make them feel bad. Effectiveness, so the program should obviously have, you can't just create a program and just be like, okay, whatever, whoever wants to come, just make your way here. You can't just say it like that. It's got to be organized. It's got to be structured. You've got to have clear goals and you've got to have clear objectives that meet the purpose of the program. And strength-based. So strength-based means that it's got to, again, cater to the needs of young people. A mental health program you're creating for adults is going to be very different from a mental health program you create for young people. When you create a program for young people, you have to remember that young people are in a different state of mind. They connect with things differently than adults do, okay? And so you might decide to, I don't know, maybe open up an Instagram page because most of the people in the program are on Instagram and that's something that they can relate to, okay? So that's basically our values and expectations, which I basically already summarized, but we have another slide on it here. Okay, so basically, yeah, as long as you know whatever's in the bolded terms here, these are kind of like the key ideas. So when we think about accessibility, it's about everyone accessing the program without discrimination. So you're not discriminating who can and who can't be in the program. When we talk about, respect, it's basically the fact that, you want to make young people feel that they're cared for in a non-judgmental way. This should say effective. I don't know why I just wrote effect there, but that should say effective. Again, achieving the desired outcomes that we planned or achieving those objectives, okay? So it's all kind of common sense. Just know what's in the bolded terms there, and that will give you the entire definition. You don't need to know the definitions of this word to word, just the key idea. Okay, so what are some mental health care services available to young people? So if you're experiencing a mental health issue, what are the different places that you can go to get help? Number one, the best mental health care service that is obviously available is Medicare. Now, Medicare is not a mental health service in itself, but it is our public healthcare system. So whenever your parents go to the doctor or whenever you go to the doctor, you'll notice that there's a green card, okay? That green card is the Medicare card. And the Medicare card obviously allows you to go to the doctor, but it also does allow you for other options or other services as well. So you can go to a public hospital. You might be able to visit a psychiatrist in a public hospital with your doctor's referral. Okay, so obviously depending on the situation, Medicare can be a good thing for you. A lot of young people, when they first feel like they have mental health issues, they don't just book an appointment with a psychologist. Number one, psychologists are super expensive. And number two, a lot of young people don't even know where to start with when it comes to finding a psychologist, okay? A lot of the time, young people don't know where to go. So the first best option is for them to go to their local GP. And obviously, if you go to the doctor, you do have to show your Medicare card. So these two first points are kind of linked there. Remember that if you are going to get referred to a psychologist, usually a doctor is one of those people who can actually write down a referral and refer you or give you a suggestion of which psychologist to go to as well. Specialist services. So this is where our psychologists and all this other stuff come up. Obviously, young people are not going to turn to these people first. Usually they go to the specialist services after they're referred to by a doctor or by a GP. And the last thing is hospital care. So obviously, a lot of the time, hospital emergency departments are accessed by young people. Now, you can't go to a hospital emergency department and be like, oh my God, treat me. I've got depressive thoughts. Because obviously that's not how it works. But like a lot of the time, if a young person is experiencing like depression and they've self-harmed or they've self-inflicted an injury on themselves, or it's just an accidental injury or whatever, they can go to a hospital emergency department to get some treatment for that. Okay, and then that hospital department from there can refer them to other mental health services. So those are some examples of mental health services that young people can access. Okay, what are some government and community programs? Now, Headspace, we've all talked about Headspace, or we might have talked about it in the previous chapter. I keep getting confused between Psychology 1 and 2 and Health 1 and 2. So I'm pretty sure we have covered Headspace at some point this year in health. Headspace is our National Youth Mental Health Foundation, okay? So it's a government initiative. All states and territories in Australia have a Headspace Centre or have some kind of Headspace initiative happening. Headspace is really good.
We've also got like Black Dog Institute.
Yes, the Black Dog Institute, correct. So Headspace is kind of similar to that. Yeah. So Headspace, is basically, it's good because it's specifically for young people, so people aged between 12 to 25 years old. And so a lot of the time, you can actually go into a Headspace center and they can really help you out. And Headspace, I'm pretty sure Headspace services are either free or very, very low cost. So it's like you wouldn't be paying the same amount as you would if you were to go to a real psychologist. But the beauty of Headspace is that in Headspace, you have got real psychologists and real social workers and real kind of mental health professionals working there. So it's kind of like you're getting all the support that you really need, as if you were going to an actual psychologist. Okay, so obviously the best thing about Headspace is that they don't make depression, they don't make it seem like a big thing. They take it one chunk at a time and they take it one step at a time. And they don't want to intimidate young people or make young people feel, feel overwhelmed with paperwork or with all the details. They just take it one step at a time and just talk to the young person. Okay, and that was Headspace's slogan when they first started out, that Headspace is a place where young people can go to talk to someone. Okay, so that's basically their business model there. Headspace is probably one that I will talk about a lot because it's the oldest kind of government strategy with reference to mental health. We've also got Youth Beyond Blue, and you might have heard of Normal Beyond Blue. So Youth Beyond Blue is the youth kind of segment or the youth branch of Beyond Blue. and it also focuses on young people. It's a little bit of more of a newer program. They were kind of inspired by Headspace. They wanted to create their own youth branch for Beyond Blue. But a lot of you would have heard about Beyond Blue. That's just the general mental health program. Okay. Now, obviously, Youth Beyond Blue, Black Dog Institute, Headspace, all of these government strategies or government programs are focused on depression. That's the major focus. But if you've got anxiety or if you've got stress, they will also help you out with that as well. Okay. And the best thing about Headspace, and I think the other two as well, is they do have online platforms. So you can go online and you can talk to someone on chat, or you can talk to them through a forum online. So you don't have to go into a Headspace center face-to-face. Okay. So now we're looking at what are some personal strategies. So what are some things that you can do personally that will help you to promote or to increase your mental health and well-being? So these are some personal things you can do. Number one, you can communicate with your friends and family. A lot of the time, there's a saying that there's no problem in the world that can't be solved with a bit of, discussion or with a bit of speaking to somebody. And it's true when it comes to stress and anxiety as well. A lot of the time when you speak about what you're stressed about to someone else, it can really take a load off your shoulders. Number two, seeking help from medical professionals. So a lot of the time you might want to go to a doctor, or you might want to go to, a Headspace center. You might want to see the school counselor. If you do feel like stress and anxiety is overwhelming you, that it's not a normal level of stress that you're experiencing anymore. Also, you got to take time to relax and to kind of practice self-care, and basically kind of understand that you don't always have to be on top of everything. Everything doesn't always have to be perfect. And you need to give yourself kind of a bit of like leeway to make sure that you don't put so much stress and pressure on yourself to be the most perfect person in the world all the time to everybody. Okay, so that's basically personal strategies that will help you to better increase or promote your mental health and well-being. Now we're looking at some costs associated with mental disorders. So what are the costs? And when we're talking about costs, we do talk about financial costs associated with having a mental disorder, but we're also talking about the other costs. So what are the emotional costs? What are the costs that we can't measure in terms of money? Okay, so the first cost that we talk about, and you do cover these again next year in Unit 3, not with reference to mental disorders, but you will cover what these mean next year as well. So direct costs are basically costs relating to money. So they're costs that we can actually measure in monetary terms. We can put a dollar amount to this kind of cost, okay? So an example is if I've got depression and I have to buy antidepressants or tablets to, to treat my depression, those antidepressants, I'll have to go to the chemist or I'll have to go to my psychiatrist and I'll have to purchase them, yeah? And when I purchase them, I do have to give actual money to purchase them. So that's why an example of a direct cost for depression could be the cost of antidepressants, the cost of my psychology consultations with the psychologist, which could be thousands of dollars or hundreds of dollars. Those are direct costs because we can measure them in terms of money. Indirect costs are not measured in terms of money, but then I'm still losing money indirectly, if that makes sense. So what this means is, I'll give you an example, is if obviously like I'm a teacher. So if I develop depression and as a result of depression, I don't show up to school and I'm not coming to school, I'm not giving money to the school and being like, here, take my money, but indirectly I'm losing that money, right? By not going to school. Similarly, if a young person works at Macca's and they are not able to go to work, they are indirectly losing money because of the fact that they're not able to go to work. Yeah, because they've got depression. Depression is what's causing them to stay at home and not have the motivation to go to work. So indirect cost is not where you're giving money directly to the person to pay for a service, but you're losing money indirectly as a result of having that disease. Intangible cost. Now, tangible is something that you can measure in terms of something. Intangible is something that can't be measured. So intangible costs are basically costs that are difficult to measure in terms of money. They're difficult to describe in terms of financial kind of definitions because they are to do with the emotional or human costs of having a mental health condition or disorder. So if you've got depression or your friend's got depression and they're no longer speaking to you, you feel like emotionally you're disconnected from them, okay? They might feel like emotionally they've lost all the people around them, okay? If someone with depression goes on to commit suicide and they successfully are able to commit suicide, and obviously they like pass away, it's going to be a human cost for people around them, because we've lost an important person, we've lost an important human who might have been a brother to someone, or a father to someone, or a sister to someone. Okay, so intangible costs are costs that you can't describe in terms of money. It refers to things like the pain and suffering of having depression, death from the depression, losing someone you love from the depression, all those things that we can't measure with a dollar sign, basically. Okay, so those are our 3 costs. If you know at least one example for each of these, it should be more than enough. Okay, oh, and I've already got examples on this slide. So why did I talk so much on the previous one? Never mind. So yeah, these are some examples. So you just need to know one example for each of these slides here. You don't really need to worry about cost to the community here. Just worry about the cost to the individual. Okay? So one for direct, one for indirect, and one for intangible. So this is like individual means the cost for the person who has depression. Community means the cost for the people around the person who has depression. So costs for the school, costs for the workplace, costs for the family. So basically the costs that are incurred by people who are living around the person who's got that depression there. Okay, the last topic we're doing is literally one slide, and it's literally probably going to take me 2 minutes to go through it. So 6.5 is opportunities for youth advocacy. Okay, advocacy is a very important term. Now you might know what this word means just from English. When you're an advocate, when you advocate something, it means you are passionately supporting that particular thing. If I'm an advocate for human rights, it means that I don't just think human rights are important. I think human rights are essential. I will not rest until human rights in a particular country are fulfilled. Okay, so obviously advocacy doesn't just mean you lightly support the idea. Advocacy is when you show a complete passion and a complete support and motivation towards making a positive change in that issue that you're passionate about. Now, youth advocacy is basically defined as young people being advocates of something, okay? With reference to this chapter, we're looking at young people being advocates for something like mental health, okay? So young people, or youth advocacy, works on this idea that young people always have a motivation to promote their health and well-being. But if you boss them around and you say, why are you always, why are you just sitting in bed all day? Why don't you go outside? Why don't you create a mental health program? Psychologically, young people are never going to do something when they're bossed around to do it, okay? But what we're saying is that if we give young people the value, if we tell them, you know what, I really value your input. I think you've got some really good ideas. I think that you can take the reins and you can actually create this program. I'm going to give this up to you. It's up to you on how you want to do it. If you give them that control and you value their ideas and you value their contributions, they're going to be more likely to want to promote their health and well-being and make better changes in their community, okay? So it's about adults, rather than always bossing young people around, it's about adults kind of giving some of that responsibility and some of that initiative to young people to actually see what young people can produce. Because a lot of the time, health promotion is connected to youth advocacy. When you give young people control to make a health program or, make a petition for increasing mental health services in the area, or make a GoFundMe for, basically developing some kind of new mental health initiative, or join a Headspace rally, or, create a program, or create a fun run or a marathon that raises money for people living with depression or young people living with depression, then that will be a really good example of youth advocacy. Okay, so youth advocacy is all about young people being advocates for mental health or for any other issue that they're concerned about. Could be raising funds for cancer, it could be raising funds for, better academic support and better stress management techniques. Okay, all of that stuff can be. Now, obviously, just before we finish, I'm just going to go through the 4 goals. So when youth advocacy is successful, when we do give young people the responsibility and we value them and we give them the control to make these programs, to be involved in these decisions or law or changes in policy and law with reference to health, this is what can happen. Number 1, advocacy can encourage participation. More young people want to get involved. Number 2, we can address inequalities between young people. So if young people are currently experiencing vast differences in terms of their health compared to adults, we can address those inequalities. we can try to improve health services and programs. Rather than having a 50-year-old or 40-year-old person trying to create a program for young people, we can get a young person on board. We can say, okay, as a young person, what do you want? What do you think young people will be interested in? And number 4, we can change the attitudes and values. So rather than young people feeling like no one cares about me, no one ever gets my input when it comes to developing health programs, it's always adults doing what they want, young people can actually feel like, yes, in my society or yes, in my community, I can make a meaningful contribution. I can be given the power to create a mental health program if I so choose to, or if that's something I want to do. Okay, so that's basically what youth advocacy is. Now, you just got to know basically the definition and just know 2 goals. You'll need these goals to answer your questions as well. One of your questions in your learning, in your questions there in 6.5. And just know 1 example. So you can easily make up an example. A lot of you are always about doing petitions at school whenever you want to change something. So that could be something that you want to go with. Maybe a petition to increase the number of mental health services in an area. Okay, so just think of 1 example or make up 1 example on your own and kind of memorize that and put that into your notes. Okay, so that's up to you to basically decide what you want to do. Something easy could be getting your friends together to participate in color run or to participate in a fun run or marathon that raises funds for young people struggling with depression. Easy. Okay, so just any 1 example there to support your definition of youth advocacy. And that's basically for chapter 6. And we are basically, it's 11:50, so we are done with our online session now. Now, just before you go, I just need to show you your due work for this week. So on the week 5 tile, I have uploaded this PowerPoint for chapter 6, and I have uploaded this questions checklist. Now, we have chapter 6 today, so you will do all the questions. There's not that many, to be honest, and the questions are super easy. You can just use your PowerPoint to answer them.
So the whole chapter, miss? Did we finish the whole chapter?
We did finish the whole chapter, yes. So yeah, that's basically what I want you guys to do for the rest of the week. Now, in the next session, next online session, I will introduce your assessment to you, which is your next outcome 3 project, which will be marked as a SAC. That's not due this week, obviously. That's due, I think, on the 22nd. Yeah, 22nd. So that's due next Friday. But I will be introducing it this week. So those of you who want to get started on it from this week, you can get started on that. Okay, so I'll introduce that criteria sheet to you in the next online session. But for now, if everyone is all good, we can kind of move on to our class page and start with our questions. So you've got all the questions there, just starting on those questions now and just kind of finishing up your summary notes or going through the PowerPoint again if you have to. Okay, guys, so that's basically it for today.